theme today is expanding the ecosystem, which has all the elements, getting to know people like we are now, using the other person's toolkit. Next we have a great story of exactly that point, the other person's toolkit. Here's Melissa Nolan, and she's going to talk about mosquito habitat, not a problem on Mars, but it is here on Earth, and how oil field technology has been effectively deployed to make that happen. Melissa?
Good morning. It truly is a joy and a pleasure to be here today. So I'm a clinical epidemiologist from Baylor College of Medicine, and I had the good fortune of meeting with some upstream folks from ExxonMobil, and we kind of came together and came up with what I would argue is a really innovative idea to help tackle some important public health issues. So today, I'm going to give you just a little background of a project that we're just starting. So I hope that it can be useful, and I hope we can have some good discussions too in the breakout sessions. So first, the United Nations sets priorities on how we're going to improve global quality of life, if you will. So every 15 years, we come out with new priorities. And again, the reason this is important is that these ultimately influence the policies, which determines how money is allocated to different avenues. So in 2000, there was roughly 8 that were determined, and these can range in all different aspects of quality of life. So this can be related to human suffering from war and conflict, it's related to environment, it's related to nutrition, education, and certainly, of course, health. And so in 2000, there were 8 that they had targeted, and health was kind of integrated in 6 of these 8. So it was a really big priority. We had a lot of great successes, and so unfortunately then, when we moved into 2016 to come up with what's going to be our next set of Sustainable Development Goals, there are 17, but health is only 1. And so instead of being integrated into a lot of them, it was really restricted and refined to just 1 of these 17. So even within that one, when we think of health, health is such a broad topic, right? So it can be anything from suicide prevention and mental health, it can be healthcare access, it can be maternal and child health, it can be infectious disease research. So ultimately, there were 9 different categories that they came up with. And infectious diseases, which I specialize in, was restricted to just 1 of these 9. And even within these, just this one subsection of infectious disease, it was restricted to just a few, so really 5 that were highlighted. And unfortunately, mosquito-borne diseases, which is one of the things that I'm most interested in, wasn't even ultimately listed on here. And the reason I would argue that mosquito-borne diseases are so important and worthy of our time is that mosquitoes are, in fact, the world's deadliest animal. So more people die every year from mosquito-borne diseases than they do from other people, from sharks, from snakes, from ultimately any animal. And so, in fact, there's more people dying from mosquito-borne diseases every year than there are people living with HIV in the United States. And so, it's sad to me to think that, and while it's very important to prioritize some of these non-communicable diseases or other infectious diseases, mosquito-borne diseases really should be a target because it does have such a high disease burden international and large ramifications for health. So when we even look at mosquitoes, there's 3 primary vectors that we're focused on, and they're all very different. So Aedes, you might have heard of Aedes albopictus or Aedes aegypti. It's also known as the Asian tiger mosquito. This is a very voracious mosquito. So this is the one we see in urban environments. It really likes to bite people in comparison to Culex mosquitoes, which kind of prefer to bite birds or other animals. Aedes is really one of the main ones that we're most concerned about. And I wanted to highlight here, you can see the different colors of diseases that are transmitted by these different species. So those that are in red, so chikungunya, Rift Valley fever, Zika, West Nile, none of those have a vaccine. There's also no treatment for these. When we look at those that are in blue, they do have vaccines, but you can imagine we still have challenges, lots of different challenges, just logistically, and then also convincing people the value of getting these vaccines. So again, prevention is still really important. And again, these diseases do not have treatment as well. And when we look at those that are in purple, there's no vaccines, so prevention is the only way of preventing new disease. But yet, there is chemotherapy for these patients. Again, though, prevention is the most important. So I would argue that one of the consequences of this change in our shift in priorities away from infectious disease prevention is that we're seeing a big resurgence and lots of epidemics from these diseases. So just one case example is chikungunya. So for those that aren't aware, it's an alpha virus that's transmitted by the Aedes mosquito. We used to only see it really transmitted in Africa. We saw a little bit in the 60s and 70s in the Asian islands. But in 2013, we saw the first cases reported here in the Americas for the first time. And in less than a year, it had spread to almost every country in the Americas, including the United States. We've had local transmission in Florida and in Texas. The reason we care about chikungunya, the name itself actually means that which bends up. So it's an incredibly debilitating arthralgias that come, and so it might not kill you necessarily. We see low mortality with it, but the morbidity is very concerning. So patients will have for months following infection these incredibly painful arthralgias that you can visibly see how they're disfigured from it. And then sadly, they get to a point when we start to think they're starting to recover, and then they'll go back into relapse. So we can have long-term morbidity from this disease for years following infection. And you can imagine adding that to an area where we already have these impoverishing conditions, and now they have an inability to work. This can really impact and have large economic concerns. And of course, Zika, we're all very familiar with this flavivirus. The big concern with this one, of course, is that it can be congenitally transmitted, and babies that are born from pregnant women that are infected can have microcephaly, which absolutely has its own ramifications for long-term health in these children. We also see a higher number of Guillain-Barré syndrome patients with this, which is a very severe neurologic condition. So again, Zika is another classic example that unfortunately is a change in this, and the change of our priorities. We're seeing big outbreaks. Historically, we really only ever saw it in Africa, and then in the late 2000s, we started seeing a couple cases circulating in the Asian islands. And then in 2015, we saw the first case here in the Americas. Again, within a year, we saw rapid expansion all throughout the Western Hemisphere, and we've seen cases here in Texas and in Florida. So you might be thinking this is a very doom and gloom talk, and I don't mean to be that way, but I do want to kind of talk about how we can influence and best prioritize our priorities when it comes to prevention. So there's a lot of aspects when you think about how are we going to prevent these mosquito-borne diseases. First of all, there's thousands of arboviral infections that are known at this point. There's hundreds of different mosquito species that are known to be competent vectors. So that's a major limitation, really knowing who is going to be the next vector that's going to cause, whatever disease. How can we prioritize and anticipate that? There's also, even within the ones that we know could be a big concern, there can be mutations. There's some discussion with Zika that there was an alteration that made it as voracious as it was in the Americas. There's certainly concerns with lack of surveillance. So when we think about these very resource-poor, limited areas, and then now we've taken away their ability to do any kind of surveillance, it's hard for us to know who might be the high-risk populations and what diseases are actually circulating. Another concern is globalization. Houston is a classic example of this. So a couple years ago with chikungunya, when it was a big concern here in Houston and in the United States, we had an oil and gas member that had gone overseas, had gotten chikungunya by the time he came back, was diagnosed with it here. And so the concern is that we have these mosquitoes. The virus just hasn't been introduced in them. So it would only take one mosquito to bite him, become infected, and then the potential for transmission is a reality. And in fact, we had several different patients at Baylor that we had worked with that we strongly encouraged them to do a voluntary quarantine, so to stay in their house for 2 weeks. But I don't know about y'all, I could not stay in my house for 2 weeks. That would be really hard, right? I mean, we all have jobs, we have friends, we have a life. So that's another component to prevention. And then always, whenever you work in health, there's always a challenge with convincing the industry to create better diagnostics and vaccines and therapeutics for us. So that's another way that we contribute. So again, like I said, not trying to be doom and gloom, but I wanted to talk about how I think we kind of had a perfect marriage with ExxonMobil to come and tackle how one of these aspects, which is just how to prevent spread of disease. So there was an article that came out in 2006. So the Belizean government knew that malaria was a big concern for them, and they only had so much money, so they were trying to best utilize what they had. So they said, hey, can we use these satellite images and do some remote sensing technology to identify just bamboo, areas where there's a high density of bamboo, and can we use that then to say, okay, this is where we're going to target our mosquito spraying? And it worked. They were able to identify 75% of the time these areas where bamboo were from just this quick and easy computer modeling. If it said it was bamboo, it truly was bamboo. And so that kind of gave us that idea. We started working with ExxonMobil. And ExxonMobil, I would argue, is really truly one of the experts in remote sensing technology. And the reason for this is they use it on a regular basis for identifying new areas for oil exploration. So as you can see in these photos, on the bottom left-hand corner, this is what an aerial imaging satellite. This is what natural oil slicks look like. So you can see these little white streaks. That's where just naturally from the ocean bottom floor, oil seeps up to the surface, and that could be a way for them to say, this is where we should start trying to dig for oil first, prioritizing. You can also see, too, in the bottom right-hand corner, this kind of white strip. That's just an example from an aerial from an aerial airplane, an example of what these oil slicks look like. So it's very visible. So they do that. They're also interested in assessing environmental impacts. So before they go into a new area, they can look at what kind of habitat is there, what vegetation's there, how healthy is the vegetation by looking at the chlorophyll count. And then they'll do that. They'll come back after they finish their post-exploration studies, and they'll track for several years after to see what kind of impact they really had and how they could improve. And so together we said, okay, well, at Baylor, we're really good at GIS and health, and at ExxonMobil, you guys are really great at detecting these new areas that could be associated with different geographical features. So our question is, can we come together and rapidly and cost-effectively identify what could be mosquito breeding habitats so that we could be more enhanced in our ability to prevent mosquito-borne disease? So not only developing this model, can we do it? How do we evaluate the efficacy of this model? And then how can we determine the sensitivity and specificity using different satellite imaging providers? So basically, ExxonMobil and here in the United States with Baylor, we have the good fortune of using really the best high-quality satellite images. But maybe the government of Malawi or the government of Belize doesn't have access to that. So how can we evaluate how much better or how much worse, and how could we improve that so that it could be integrated for them? So just a quick overview of what our project is actually going to be. So we're looking for two primary vectors. So we're working with Harris County Mosquito Health. They are already, you'll be happy to know, your taxpayer dollars are hard at work. They already routinely screen for Culex mosquito, which is going to be seen on your bottom right-hand corner. So this guy transmits West Nile, St. Louis encephalitis. It's more of the country mosquito, if you will. So it kind of likes to be out in a rural environment. It likes very grassy, vegetative areas. And in contrast, the Aedes, which we see on the bottom left-hand corner, is more of the urban or the city mosquito. And that really likes to be near human habitats. It's going to be in your bird bath that you haven't cleaned out for a couple weeks. I'm guilty of it too, don't worry. But so it's going to be in these little canisters and more associated around human homes. So we have a lot of work cut out for us. So we picked 3 areas. We picked 2 that we thought would be associated with mosquitoes. So in the top right-hand corner, in 2014, we had the largest outbreak of West Nile virus. And so we used that as our most recent way of kind of predicting what could be associated with the Culex mosquito. So the top right, or you see up in the spring area, red is going to be associated with more human disease. Blue is associated with less. And then the larger the black circles, the more mosquitoes that were positive. So spring really is a hotbed area for West Nile. And this isn't just the first time we've seen that in 2014. We've seen that consistently over years. And then when we think again of where we might see Zika or Chikungunya, fortunately we haven't seen that yet in Houston. So we didn't really have a way of kind of knowing an area like we did with West Nile, but we anticipated again in the downtown area in the ship channel. So as you can see there, that's where we anticipate there could be these Aedes mosquitoes, high abundance. And then we have our control area, which is out in Katy. So for anyone that lives in Katy, rest assured that you have the lowest incidence of mosquito-borne disease. So for anyone that Do we have any Planet Money fans? Anyone listen to Planet Money podcast? So satellite imaging has become relatively so cheap because there's been this explosion. There's hundreds of companies sending satellites up that even an NPR podcast has their own satellite in the sky right now, taking pictures of avocados to predict, it was like guacamole fest or something. So there's certainly not a shortage of providers for us to give us satellite images, but again, there's a wide range in quality. And so we tried to figure out who would be our best bang for the buck. So there's essentially two types of satellites. There's these very small ones that can take pictures for you every day, which is great when you have a constantly changing landscape. However, they don't have great pictures, so that's going to be the Sentinel-2 and Spot 6. So the pixel size, the smaller the pixel size, the better the picture, just like your cameras, right? And then at the same time, Worldview 2 is better. They have a higher number of bands. So bands means color. So just being able to distinguish between black and white versus a whole spectrum of color. And so we ended up going with Worldview 2. It's one that we thought, again, was our best bang for our buck. It's affordable, high quality, and in our price range. So just to kind of bring home a little bit of how satellite imaging has progressed over the years, so Worldview 2, what we're hoping to use, these stars are associated with the new color bands. So now we can see infrared, we can see varying shades of yellow and blue, which if you're thinking about mosquito habitats, it's mostly associated with water, right? Water and vegetation. So having that yellow, having that blue is really, really important for us. And this is just to kind of give you a graphical depiction. So the article that I had mentioned from 2000, they had Worldview 1, which was on the right. So at that point, it was really just black and white, versus what we have now, Worldview 2 on the left. And so you can see it's a lot easier for us to kind of pick up and distinguish between these habitats. There's a couple of different ways that we can actually train our computer model, if you will. One of those is just physically going out and saying, okay, this is a tire. This is what a tire looks like, and then we can work with our imaging from that exact GPS coordinate to train it that way. Another way is creating the perfect balance of your color band ratios. So when we're thinking about mosquito habitats, that could be, for example, your neighbor's pool, and they have been very neglectful of their pool, and they haven't cleaned it out all summer, and so now it's stagnant, and there's algae growing in it. It's a lot of overlapping between greens and yellows and blues, and so that could be another way we could kind of find this perfect mixture to say that that could be a certain image. And then another way could be image classification, so that's using similar items to say these are the same. So an example could be having a Gala apple and having a Honeycrisp apple. They're different apples, but they're both apples, so kind of training the computer model to pick up and recognize both. So one of the things I love about being in science is that there's never a lack of challenge. And that's, I think, one of the great things about coming to this conference as well and trying to get new ideas. So we know that there's going to be some challenges, right? There always is. We're hoping to come up with some good ideas on how to accomplish those, but a couple of them are just going to be physical. So when you think about satellite imaging, there's clouds. I mean, you can't get rid of that, right? So the satellite comes over every 6 months or so to take a high-quality photo. It can't help it if that just happened to be the day that a hurricane was coming through or a tropical storm, and so that can be a big issue. So with that, then we can use these smaller, maybe less sensitive images to kind of help fill in the gaps for us. From a technical standpoint, if it's raining, there can be haze. Depending on the angle that the satellite is taking pictures, it's just sheer physics and the way that the quality of the images is. Certainly when you have different computer software, so anyone that's coders in here, you can appreciate, we have a statistical software program that we're using, which is different from our GIS program, which is different from our satellite imaging. So having all of them come together and speak in one uniform language, that's going to be really fun. And then, of course, just from a statistical standpoint, adjusting for the fact that there are certain variables that we can't control or things that we might not even be aware about. So those are going to be, hopefully, some of the exciting challenges that we're going to overcome in the future. And then what my goal for this is that our project here in Houston is going to be a good, solid proof of concept, and we can expand this out in other ways. So one of those, a big concern right now for our Department of Defense is that our servicemen that are serving overseas in Iraq and Afghanistan are really suffering from visceral and cutaneous leishmaniasis, which can be very debilitating. These are transmitted from a sandfly. It can create really huge, large scars that can lead to secondary infection. And so our hope is that we could work with them to kind of adapt this model in that environment. Another one, of course, is malaria. We're all very concerned about Malaria International, so our hope is that we can work with these local governments to find a cost-effective way that's specific to the Anopheles mosquito vector. And then another one we're interested in is looking at integrated vector management. So in Houston and all throughout the world, each in particular habitat isn't just home to mosquitoes, it can also be home to ticks. So in Uvalde, for example, if anyone's ever been out to San Antonio, we know that those little cactus, so underneath them, we can find in the same exact spot, we can find sandflies, triatomines or kissing bugs, we can find mosquitoes and sandflies. They all live there together. So that's another aspect that we're gonna have to take into consideration with this. And then something that I think will be a whole nother spinoff that would be really interesting is, can we use dog sniffing technologies to validate these models as well? And it certainly takes a village. Nothing in science can be done alone, which is, I really think, one of the themes of this conference as well. So I would like to thank from my ExxonMobil team, Jerry Halfan and Tim Nedwed. They've really been very instrumental in getting this off the ground. Dr. Abby Alayomi and Dr. Sarah Gunter are with my team here, and we're going to be really bringing in the environmental health and the health aspects, and then working closely with Harris County Public Health. Dr. Mustafa Daban is the director over there. And this project has been generously funded by ExxonMobil Foundation, and then satellite images were provided from Digital Globe. And that's it. Questions?
That was a great talk.
Thanks.
Bill, you set this up today. Why don't you go up on stage and have a little conversation of how Exxon really kind of got behind this. Maybe Dr. Lumsden can chime in with a few thoughts from the medical side as well.
Yeah, I want to explore this idea of expanding the ecosystem, borrowing from the neighbor's toolkit. I mean, you've been in the field of public health, and obviously is one that it takes great expertise, a lot of people working on it. How have you seen that this whole field has benefited from just bringing in other technologies from elsewhere? I see the satellite technology from the oil field. I see the GPS coordinates. How do you see this going on from a public health perspective?
Yeah, well, I think to tackle these major problems, we have to rely on each other's expertise. I know that the more I learn, the less I know. And so it helps me and it benefits me greatly to work with others to kind of generate new ideas. And I think it's a very integrated system.
Right. I'd also like to ask for the attention of the students here. As you're preparing for a career, you're going to be studying intensely in a variety of fields, including a major field. But your success, I guarantee your success, will come from innovations that come from places you have no idea. For example, just our lives. I drove here using the GPS on my phone, on my pocket. I've learned that I can actually access public satellite sites to do what I want to do for reasonably small amounts of money. And I tell you, I'm preparing for a holiday picture for my family coming up, and I am seriously incorporating drone technology to get that high shot. This is an amazing concept, and I want everybody to really get behind that and understand that. Melissa, any more comments about the other person's toolkit?
Well, I think in health, we really have a lot to learn. I think it's classically defined by DeBakey that we can work together and create new solutions on how to tackle these diseases. Whenever you're in a healthcare system, money's always tight, resources are always limited. I'm sure it's the same at NASA as well. And so it's really coming together to come up with new ideas to make it more effective and more efficient collaboratively.
Okay. Well, thank you.